information on Dallas Renal Group can be found on its website at dallasrenalgroup.com or on its Facebook page. It is also sponsored by Zyga Healthcare Group. We're a leader in providing senior living, home health care, and hospice-related services throughout the entire DFW Metroplex. Folks, my name is Dr. Parin Makadia, and I'll be co-hosting today's show with Dr. Sri. You can watch us live on our Facebook page, and after the show, head on over to our new YouTube channel called Doc Talk Live and like, comment, and subscribe to see great shows we have scheduled in the upcoming weeks. Folks, more details can be found on our website also on doctalklive.com, and if you are a healthcare professional and would like to be on our show, please send us a request through our website or through our Facebook page.
Good evening, listeners. This is Dr. Sri, your co-host today for Doc Talk Live. Ladies and gentlemen, we have a great show lined up for you all. We are going to be talking about hypertension and cholesterol. We have with us the experts, Dr. Sophia Rahman and Ms. Amanda Galloway, who's going to be taking our calls and questions. I want to start off by saying, as we all know, someone has hypertension or cholesterol problems. These health concerns are so prevalent that CDC states that 1 in 3 adults has high blood pressure and 1 in 8 has high cholesterol. And as we all know, both of these can lead to heart disease and stroke, which are the leading causes of death in the United States. To be part of this conversation, please call us at 972-235-5555. Once again, the number is 972-235-5555. We'll be happy to take your questions live throughout the show. Dr. Rahman and Ms. Galloway, welcome to Doc Talk Live. Thank you so much for volunteering your time to be part of this show today. Please tell our listeners a little bit about yourself, Dr. Rahman, followed by Ms. Galloway.
Hi, first off, I just wanted to thank Dr. Makadia and Dr. Sri, as well as Dallas Renal Group, for inviting us to the show today. We're both very honored to be here. First off, my name is Dr. Sophia Rahman. I am an internal medicine physician with Dallas Medical Physician Group at Dallas Medical Center, which is off of 635 and Webb Chapel. We're an outpatient-based practice currently accepting new patients, and my co-host today, Amanda, and I would be very happy to see you. Other than that, we're looking forward to answering any questions, and I just wanted to add a shout-out to my mom, and I'm hoping that she's listening.
My name is Amanda Galloway, and I'm a physician assistant working with Dr. Sophia Rahman at Dallas Medical Physician Group. I've been practicing as a PA in family medicine for 13 years. Our office hours are Monday through Thursday, 9 to 5, and Fridays, 9 till noon. And if you're unable to remember our phone number, please check our website. It's www.dallasmedphysicians.com.
Excellent. Thank you, Dr. Rahman and Ms. Galloway, for coming on our show. Let's get right to it. So our first question is for you, Dr. Rahman. Can you please start off by explaining to our listeners what high cholesterol is and how it is diagnosed?
Yes, Parin, that's a good question. First of all, cholesterol is a waxy fat-like substance that your body needs to produce cell membrane, hormones, vitamin D, and bile acid, which actually helps you digest the fats in your food. However, when it gets to be too much in your blood, it can actually build up on the walls of your arteries, and that can lead to heart disease or strokes. And to answer your second question, usually in the office or in your laboratory, we like to do a simple blood test, and that's called a lipid panel. It's broken into 4 components. You have a total cholesterol, you have an LDL, which is basically your bad cholesterol, or your HDL, which is the good cholesterol, and the triglyceride, which is considered another fatty substance found in your body. It noted that adults should be screened at least once every 5 years, starting at the age of 35 for men and 45 for women. However, based on risk factors, we try to do it a little bit more frequently, depending on their total cholesterol, or again, other risk factors like cardiac factors or diabetes.
Thanks, Dr. Rahman. Ms. Galloway, now that we have diagnosed cholesterol disease, how can it be treated? Can you tell the listeners?
Sure. By lowering high cholesterol levels, it's important for all age groups to make sure that their cholesterol is well controlled, whether you have heart disease or without heart disease. If you have high cholesterol, you should eat a healthy diet, exercise regularly, usually about 4 to 5 times per week for 30 to 45 minutes. If you smoke, I strongly encourage that you think about quitting, and you may need to be on a medication, and there's many different kinds of medications. Statins are usually the most commonly used, and in usually diabetics, they should be on a statin to help reduce their risk.
Excellent. For the folks who are joining us, you're listening to Doc Talk Live, and we have Dr. Rahman and Ms. Amanda Galloway on our show talking about high cholesterol and high blood pressure. Dr. Rahman, can cholesterol or high cholesterol be prevented?
Yes, and there are several ways that you can do that. As you know, Amanda said earlier, it's very important to eat a healthy diet, and that includes, diets that have, a good, good fat. In other words, I wouldn't say saturated fat would be good for you. You want to maintain a healthy weight. That would be very important. Being overweight has been noted to increase your cholesterol level. And you want to exercise, and this is again what Amanda said earlier. A lot of people focus on the bad cholesterol, but we also focus on the good cholesterol, which is the HDL that I mentioned earlier, and exercise will really, really help in that.
All right, thanks, Dr. Rahman. Ms. Galloway, why should someone be worried about the cholesterol? What does it do to us?
Well, too much cholesterol in your body means that you have a much higher risk of developing cardiovascular disease, which can lead to heart disease and also put you at a higher risk of having a stroke. Cholesterol, too much in your body, can build up inside the walls of these arteries and that carry the blood to your heart. And this buildup, which occurs over time, causes less blood and oxygen to get to your heart. And this can cause chest pain and heart attacks. So you want to decrease the risk as much as you can with the lifestyle changes.
Dr. Rahman, would you like to add anything?
Yeah, I wanted to add, just to kind of simplify it, just consider your arteries as like, water pipe. And if the cholesterol, blocks your water pipe, you're not getting enough flow into, the heart or your brain. And so when it's blocked, you can be in a little trouble. So that's where the heart attack and stroke comes in. So I just wanted to kind of add that in.
Thanks, Dr. Rahman. Let's take a call. Doc Talk Live, what's your question for the expert? Yeah, thank you very much.
Amanda, you want to go ahead and take that?
Okay. The cholesterol being 200, your total cholesterol, you do have to look at the good fat and the bad fat together. Your HDL being 54 is a good number. And if your LDL, depending on what that number was, could be fine. That good can kind of outweigh some of that bad and make your total cholesterol higher. So I would really have to see the good and the bad numbers to make, see if there was any changes that would need to be made to your diet. Genetic factors do play a part as well.
Excellent. For the folks who are just joining us, you're listening to Doc Talk Live, and we have Dr. Sophia Rahman and Ms. Amanda Galloway on the show, and we're talking about high cholesterol and high blood pressure. The number to the studio is 972-235-5555. Dr. Rahman, what affects blood cholesterol levels?
There are several factors, and Amanda just said it. Genetics, that's number one. Number two, age. It can actually begin to rise around age 20, believe it or not. And as I said earlier, or for those of you joining us, being overweight. Again, this is why, in our clinical practices, or you guys might have noticed that whenever you see your doctor, they're going to be emphasizing weight loss, so don't get offended by that. And lack of physical activity is part of the factor as well. So again, we encourage exercise. Doesn't mean you need to be a marathon runner, and diet. Again,
Thanks.
Avoid those in high and saturated fats.
Thanks, Dr. Rahman. Let's take another call. Doc Talk Live, what's your question for the experts?
Okay, yeah, this is Dr. Rahman here. Yeah, so hypertension is actually high blood pressure and cholesterol. So they're actually two completely different topics, but they can be correlated in a way, but they're completely different topics. But that's a good question, though.
Thanks, Dr. Rahman. Let's take another call. Or we drop. Let's Doc Talk Live, what's your question? Hello? Hello? Let's take another call. Doc Talk Live, what's your question for the experts?
Well, the cholesterol that's listed on the labels kind of does give you a guideline, the difference between saturated and unsaturated fats. The saturated fats are the ones that you have to be careful of, because if you think about it, at room temperature, saturated fat would be a solid. This is what's happening in your arteries. So you want to make sure that, you want to have less saturated and more unsaturated fats. So sometimes that can help you.
Thanks, thanks, Ms. Galloway. One more question. Since we're talking about the cholesterol and the diet, what are some good food sources for good cholesterol?
Some really good food sources are, making sure that you're getting the good fats, avocados, nuts, almonds, walnuts, cashews, green leafy vegetables. Fish is very important. You can also take a daily supplement of a fish oil. Flaxseed, beans, any high fiber fruits such as prunes, apples, and pears. These are all good sources of the good fat, as well as also cooking with olive oil, and this can raise your good cholesterol.
Thank you very much, Ms. Galloway.
Can I add one more thing? Believe it or not, wine has been studied to kind of help with the cholesterol, but that doesn't mean to start binge drinking. So please, we are not encouraging you to drink wine every single day, but one glass is okay.
I'm sure that we're going to get more questions in the second half of the show, and folks, we're about to go right into the break in about 10 seconds. You're listening to Doc Talk Live, and we have Dr. Rahman and Ms. Amanda Galloway discussing hypertension, which is high blood pressure, as Dr. Rahman pointed out, and high cholesterol. And number to the studio is 972-235-5555, and we will be taking some off-air questions.